Good afternoon. I'm Dr. Shamdeo Prasad, the Chief Medical Officer of the Ministry of Public Health, and I am presenting today's update on behalf of the Honorable Minister Walter Lawrence. Ladies and gentlemen, you would have noticed that Georgetown continues to be the epicenter of the COVID-19 pandemic, and most of those who have tested positive to date are males with a ratio of 49 to 44. Further, it is predominantly clear that you are the main ones not adhering to the guidelines, congregating way past the curfew hours as if it were a prolonged holiday. Have you stopped to think of the unnecessary risk that you are exposing your children, your wife, significant others, your mother or grandmother to? Yes, you are exposing your entire family. As one male to another, I am pleading with you to do the practicable thing, which is to stay home and to be off the roadway. Do not think for one moment that you are invincible and that the virus cannot affect you because your area has not been identified as a COVID-19 hotspot. All of us are at risk, and the only way that we can stop these numbers from increasing and persons from dying is if you seriously follow all the advice that has been given. If you must leave home, then it is a no-no to go unprotected. You must put on your mask and keep the 6 feet physical distance. Ladies and gentlemen, we have been appealing to you to come forward if you have been in contact with a positive case or experiencing any of the symptoms associated with COVID-19. If you arrive at our facility at an advanced stage of the disease, you're placing yourself at a disadvantage, and there may be very little that we can do to save your life. Some of you continue to provide incorrect information, making the contact tracing very challenging for us. We understand the fear of being isolated or hospitalized, the stigma and discrimination, but we cannot contain this disease unless we receive accurate information. My fellow Guyanese, it is imperative that we find those persons in our community as soon as possible who can spread COVID-19 without even realizing it. We are pleading with you to access the mobile units when they come to your community. You must test your contacts and the contacts of their contacts. We must conduct tests in our hotspot areas to uncover the symptomatic and asymptomatic persons. Testing is critical if we are to contain this disease and flatten the curve. Now for the global report. Globally, according to WHO, there are 3,517,345 confirmed cases with 243,401 deaths. In the region of the Americas, there are 1,477,447 confirmed cases with 79,590 deaths, an increase of 1,763 in the last 24 hours. Today in our country, we are reporting no new cases of the additional 34 tests done. The total number of confirmed cases remain at 93. The number of persons recovered thus far is 27, and our COVID-19 deaths remain at 10. 714 persons have been tested, of whom 621 are negative. There are 3 persons in our COVID-19 ICU, 6 in our institutional quarantine, and 56 in isolation. To date, the total number of patients seen in the COVID-19 ICU is 29, with 7 deaths being registered within the ICU. The total number of patients who were transferred from the ICU is 13, with the total number of patients who recovered and were discharged from the ICU being 3. I wish to bring to your attention that our laboratory staff are working continuously to have testing done. We recognize that many of you are anxious to receive the daily results quickly at a specific time. Let me say that testing for COVID-19 is a complex process that takes at least 6 to 8 hours to complete, and it is our responsibility to you to ensure that the results are accurate. Therefore, your patience is required on this matter. I wish to end today's briefing by reminding you of the important role that you have to play. COVID-19 is no respecter of persons. No one will be spared once you are in its path. It is not a Ministry of Public Health's affair, but one that concerns every one of us. So be appreciative of the Herculean effort our frontline workers who are putting themselves at risk to protect you and me. We can beat this virus if all join forces and work with one focus and one accord. Stay at home, practice safe hygienic measures, and observe the curfew.